My name is Dr. Hilary Flett and I'm a local GP in St Helens, and I'm going to explain to you in this short video what shielding is. If you're watching this video, you should have actually received a letter from the NHS or from your GP telling you that you need to shield. Shielding is a programme which is designed to protect you. If you are shielding, you should not go out for 12 weeks. You should not be mixing with anybody outside your house, and you must be very careful about the contact that you have with the people who you live with. You should not have close face-to-face contact with anybody during this 12-week period of shielding. If you live alone and have carers who support you, that is absolutely fine, as long as they are not demonstrating any symptoms which might suggest they've picked up the coronavirus. That is a new cough or a temperature of over 37.8. If you have carers who help you with eating, drinking, or your basic daily needs, that's absolutely fine. You should not and cannot go out for food during the shielding time, and you should not exercise outside during the period of shielding. So, what if you live with somebody and you've had a letter which advises you to shield? Well, your family need to adopt really strict social distancing within and around your house. So, what does that mean? It means that you should stay 2 meters away from anybody in your house. So if this is you, imagine for 2 meters an adult lying on the floor, and this is how far away your family member should stand from you. You should not become closer than that. You should try as much as you can to live separately. If you have a spare room, either you go into that bed, if it's comfier than your own, or your partner should go to the spare room. You should, if at all possible, use separate bathroom facilities. So if you have a spare bathroom or a spare shower room, you should use that and not the main family bathroom. If you only have one bathroom, then set up a bathroom rota. It would be most sensible if you used the bathroom last, and then the bathroom needs to be fully cleaned and wiped down with disinfectant after you have used the bathroom. Have your own towel. Do not share towels with other family members. With regards to eating, either have a kitchen rota where you eat separately, or alternatively eat in your own room. And absolutely have your own knife, fork, glass, spoon, cutlery, and make sure that is washed and dried with a separate tea towel. Everyone in the house should have really strict hand hygiene rules in place. That means washing your hands with soap and water, the palms, the backs of the hands, the fingers, the thumbs, the nails and the wrists, and you should wash your hands for 20 seconds. That means singing happy birthday not just once, but twice. So if you live by yourself, who can help you? Well, family, friends. In St Helens, contact cares, your carers, your GP, your pharmacy. All of these people will make sure that you have a ready supply of food and make sure that your medication and any other needs that you have are managed appropriately during this time. If you develop any symptoms of a cough or a temperature of 37.8 or more whilst you are shielding, you need to contact NHS 111 for advice. Do not contact the hospital and do not go to your GP. So that's a lot of things that you can't do. So what can you do? Well, you can have a little look at the television and see if you can find one of the many channels which are now doing home exercising. You can open your windows and have some fresh air. That's a really sensible thing to do. You can eat healthily. You can call a friend or a neighbour or a family member. And you can certainly take up a new hobby, whether that be knitting, painting, ironing, or anything else that you enjoy doing at home. There is a recommendation that you perhaps don't watch the 24-hour news channel, because that probably will make you just feel a little bit more lonely. If you've got a computer, make friends on Facebook, WhatsApp, phone a friend, use your email, look at the internet. There's lots of social ways of now speaking to people by camera, on FaceTime, on Skype. All of these things are ways to actually help you keep in contact with people without seeing them face to face. We know it's going to be hard, but actually it is in your best interests to protect you by shielding. Thanks for listening.